Hey everyone, it's Dr. Sandra Lee, but you can call me Dr. Pimple Popper. We're here to talk about irregular periods and PCOS. Irregular periods are common and can be a sign of PCOS. PCOS can affect your skin, causing acne, unwanted hair, and hair loss. We'll break down the differences and help you understand your body. So grab a cup of tea, get comfy, and let's get into it. Okay, so first things first, what do we even mean by irregular periods? Well, a typical menstrual cycle lasts anywhere from 21 to 35 days. But when we talk about irregular periods, we're talking about things like missed periods, where you skip a cycle or two, or maybe your cycles are super long, like more than 35 days. On the flip side, some women experience short cycles, less than 21 days. And then there's the whole issue of heavy bleeding, light bleeding, or even spotting between periods. The good news is, a lot of the time, these irregularities are caused by temporary hormonal fluctuations and are nothing to be overly concerned about. So, what causes these pesky irregular periods? Well, a lot of things. One of the biggest culprits is stress. When you're stressed out, your body produces cortisol, and that can actually mess with your ovulation. Weight changes can also throw your cycle out of whack. Whether you've lost a significant amount of weight or gained some, those fluctuations can impact your hormones and lead to irregular periods. Excessive exercise can put a strain on your body and lead to missed periods. It's all about balance, people. Thyroid issues, for example, can really disrupt your menstrual cycle. And let's not forget about birth control. Starting or stopping certain contraceptives can definitely cause some temporary irregularities. Let's talk about PCOS, or polycystic ovary syndrome. It's a hormonal disorder affecting 1 in 10 women of childbearing age. PCOS can cause irregular periods, excess androgens, and polycystic ovaries. Symptoms include acne, facial hair, and hair thinning. If you notice these signs, see a doctor. Okay, so we've covered a lot of ground. Let's do a quick comparison of PCOS versus normal irregular periods. When it comes to cycle length, PCOS often means cycles longer than 35 to 40 days, and you might skip periods for months. With normal irregular periods, your cycle might fluctuate, but it usually stays within that 21 to 35 day range. Ovulation is another big difference. Women with PCOS often have irregular or absent ovulation, which can make it difficult to get pregnant. With normal irregular periods, ovulation might be delayed, but it's still happening. And then there's the whole hormonal imbalance issue. PCOS is characterized by high androgens, those male hormones we talked about, which can lead to acne, facial hair, and hair loss. With normal irregular periods, there's usually no significant hormone imbalance. So, understanding these differences can help you figure out what's going on with your body. So, when is it time to pick up the phone and make an appointment with your doctor? Well, if you've been experiencing irregular cycles for more than 6 months and there's no obvious reason for it, like stress or a recent change in birth control, that's a big one. Also, if you're having really severe cramps, excessive bleeding, or pain that just doesn't seem normal, definitely get it checked out. And remember those other symptoms we talked about, like facial hair growth, acne, or sudden weight gain? Those could be signs of PCOS, so it's always better to err on the side of caution. And finally, if you've been trying to conceive for a while without any luck, irregular periods could be a sign of ovulation problems, so it's worth talking to your doctor about that as well. So, there you have it. The lowdown on irregular periods and PCOS. Remember, lifestyle changes like exercise, a balanced diet, and stress management can help. Your doctor might recommend treatments like birth control pills or metformin. Natural remedies like spearmint tea, inositol, and flax seeds can also help. Always consult your doctor before trying new supplements. Thanks for watching, and remember, knowledge is power.